Lymphedema 101. My name is Richard Roope. I'll just give you a brief history of myself, and then we'll sort of start on the actual session. So I'm a remedial massage therapist, oncology massage therapist, lymphedema management therapist, personal trainer, private practice for over 16 years, also a massage lecturer at TAFE, which I've been there for 6 years now. I've got sort of my own practice down at Larg, Spain. So for this particular session, we're going to look at exercise and how it benefits your lymphatic system. Some of the points that Neil brought up, I'll sort of go over as well. The importance of movement and controlling your weight as well. So we're just going to go through a few things, and as Deb said, there is questions at the end if you wish. Okay, so the general benefits of exercise I'm going to look at is improved mobility and range of movement of your limbs generally. And one of the important things with movement and your lymphatic system is the more you can move, the better your lymphatic system will function. Neil touched on it in his presentation, that muscle contraction is a big part of moving the lymphatic system. So the more you can move and the more range of movement you have within your body, the better it will be. Obviously, the other benefits of exercise increase cardiovascular health, strength, increased energy levels, well-being, confidence, reduce your stress, reduce weight. Definitely reducing weight, body fat wise, or body weight, body fat mass. Improves your lymphatic system. So exercise will help your lymphatic system function faster and better. Can help reduce the risk of lymphedema developing or progressing. Can be used to help manage, or one of the elements you can do to help manage your lymphatic system and your lymphedema, if you already have developed lymphedema. So general benefits of exercise. There's obviously lots of information out on internet through the news, but generally it's a benefit of overall health and well-being that shouldn't be ignored. A reduction in body fat, improvement in general health, increased strength, balanced coordination, cardiovascular health, immune function, can help you improve your energy levels, mood, and help to combat chronic health conditions. So for today, we're going to look at some of the general benefits and also the benefits for exercise, and specifically on your lymphatic system, and different types of exercise as well. So better weight control, one of the big parts of exercise. As a society, we're now sort of 60% of adults and over 25% of children are either overweight or obese. And that's obviously progressing year on year. A weight gain of over 10 kilograms since young adulthood is a great risk of, or increased risk of, heart disease, stroke, diabetes. Controlling your weight also helps against cardiovascular disease, diabetes, and some cancers, and a range of other conditions as well. Healthier heart helps control weight. Regular exercise helps prevent heart disease by keeping blood pressure low. One of the elements that Neil mentioned. Help to lower your bad cholesterol, so your long-chain cholesterols. Can help with controlling that and improving your HDL cholesterol levels. Lower risk of diabetes. 25% of Australians over 25 already have or are at risk of developing diabetes. Diabetes can have a significant impact on your arterial system, so blood vessels, veins and arteries. So another important fact, helps to reduce weight. So general exercise can help reduce weight. Increased weight around the waist as Neil mentioned before. So diabetes will increase weight around the waist. Helps to control your blood sugar levels as well. And active muscles, so performing regular exercise activates your muscles, and active muscles will use up more sugar for fuel. People who have diabetes are at a higher risk of heart disease. So if you've got improved blood sugar levels, you can reduce your risk of heart disease. Okay, cancers. Regular exercise can help protect against some cancers, particularly your bowel cancer. According to the Cancer Council of Australia, physical inactivity is an important risk factor responsible for about 14% of bowel cancers and 11% of menopausal or postmenopausal breast cancers, and can contribute to other cancers such as prostate, lung, and uterine cancer. Regular exercise will help to prevent weight gain. And there's convincing evidence that people overweight or obese have a higher risk of developing cancers. Now, the Cancer Council recommends 60 minutes per day. Obviously, various organisations will provide guidance on what should be recommended daily amount. But anywhere between 30 and 60 minutes per day is recommended generally. Better mental health. So regular exercise can help improve mood and help with moderate to mild depression. The research institute, Black Dog Institute, suggests that people who exercise regularly will have fewer symptoms of depression and anxiety compared to people who don't exercise regularly. And that's both for aerobic exercise and weight-bearing exercise, weightlifting or body weight exercise. So it doesn't really matter what form of exercise it is, but doing regular exercise can help with better mental health. Can help with a reduction in the incidence of osteoarthritis, and osteoporosis. So extra body weight will increase the pressure on your joints, particularly lower joints, hips and knees, ankles. Physical activity will help with osteoarthritis, so help prevent it, and it can also help improve the symptoms of osteoarthritis by building or strengthening the muscles around the joints. Regular exercise will help to preserve strong bones and protect against bone thinning osteoporosis. And it's equal amount between men and women in regard as exercise. So it's important for both men and women to perform regular exercises. Excuse me. Now, the best bone strengthening exercises. Generally, as a personal trainer, I would suggest whatever you enjoy the most. But weight-bearing exercises and some form of impact are your best. So walking, jogging, running, jumping are your ideal because you want that physical activity, joint movement, but also impact with the ground. Swimming and cycling, not as good, but are still beneficial because you still get the muscle contraction pulling on the bone. So that will help to improve bone density, where the bone is stimulated by the muscle contraction. Now, resistance training, it's got here lifting weights, but it can be just body weight as well, which is just as effective. Will make the muscle stronger, encouraging the bones to become stronger as well. By performing exercise, even if you do have osteoporosis, it will reduce or slow down the progression of the osteoporosis. And the muscle strength will help with osteoarthritis. A sharper mind. Okay. Now, exercise is not going to prevent the risk factors of dementia, such as aging and any inherited risk. but there is evidence that suggests that regular exercise, such as aerobic exercise and resistance training or weightlifting, helps to improve blood flow to the brain and stimulate the growth and survival of nerve cells. So regular exercise does indicate that it can slow or prevent the progression of dementia. Now, I've got a couple of slides on the lymphatic system. We'll just go through these relatively quick because Neil sort of showed you a couple which mine are sort of similar. Just gives you an outline of what the lymphatic system does. So we'll just have a quick look there. It's just a slightly different format, so it might appeal to other people, just the viewing of it. So the anatomy, the lymphatic system is composed of both the circulatory system, which is carrying your nutrients and oxygen to your tissues, carries oxygen depleted blood back to the heart and lungs, and acts as a blood reservoir. As far as its immune elements, it recycles excess fluid from the tissues, which is back to the blood system, removes excess proteins from the tissues to return to the blood system, acts as a garbage system, which Neil mentioned as well, by removing waste from tissues, dead cells, proteins, and fats. Helps to carry your immune system to fight infection, and acts as an alarm system by carrying antigens to the lymph nodes to alert the immune system. So it's very important in your immune system. And there's just some visuals of your lymphatic system. So up on the top left, that's the circulatory system in the red and blue, and the green elements are your lymphatic system. And as Neil mentioned, they run parallel or very closely to your veins. And then across to the top right is just a blown up view of the blood system or the capillary system and the lymphatic system and their relationship. And then the bottom right is just the initial lymphatics. So this is where the fluid, your lymphatic fluid, returns or starts its journey back to the bloodstream through the initial lymphatics. And there's just a view of some of the lymphatics of the body, and on the diagram with the different lymph nodes and lymph channels. And then the gentleman on the right in blue and green just gives you another visualization of how the body is divided up. So 3/4 of the body goes through the left-hand side, left-hand armpit, and 1/4 goes through the right-hand side. So all the blue goes through the left armpit, and the right is just the green. Okay, benefits of lymphatic system, or benefits of regular exercise on the lymphatic system. So again, researchers demonstrate that exercise or activities can have a profound effect on anybody with lymphedema or at risk of developing lymphedema. So some of those benefits are an increase in your uptake of the lymphatic fluid in the initial lymphatics, again, which Neil was talking about. An increase in the pump speed of the collecting lymphatics. So those pumps go a little bit quicker as you exercise. Will help to mobilize your joints, which helps to push more fluid into the lymphatics. There's a very high concentration of lymph nodes in your armpits, elbows, groin, and behind your knees. So every time you bend or move those areas, you will stimulate the lymph nodes in those areas. So every time you take a step or two, your knees and your hips will help to stimulate the lymph nodes in those two areas. And if you're doing exercises with your arms of some form, the main action will be in the elbows, in front of the elbows, and in your armpits. Increases the muscle action and strength. So every time you contract a muscle, it will squeeze on your lymphatic system. Again, as Neil's video showed, that squeezing of the lymphatic system by the muscle contraction. The stronger the muscle, the more muscle fibers you will develop, and that will add another element to the actual contraction. So it'll be a stronger compression on your lymphatic system. Generally, your exercise will increase your rate of breath, and that will help with increase abdominal pressure, which in turn helps increase your lymphatic flow. There's a large amount of lymph nodes again in your abdomen. So by increasing breath will help with your lymphatic flow. And Neil mentioned a little bit this as well. Contains approximately 2 litres of lymphatic fluid. Lymphatic system functions at about 6 to 10 beats per minute. General exercise and specific exercises for lymphedema called decongestive exercises can increase that up to about 100 beats per minute. Manual lymphatic drainage can increase it up to about 60 beats per minute. And these physiological changes can greatly assist in preventing or managing your lymphedema, and also improves your immune system. So if your lymphatic system is functioning better or faster, it will help with your immune system. It will improve its immune capabilities. So we've just got a little bit more to go. Exercise-wise, so now as I mentioned at the very start, the best form of exercise you can do is one that you enjoy, or ones that you enjoy if there's more than one. You're more likely to maintain that level of exercise if you enjoy doing it. So they should be tailored to your likes, your fitness levels, your current health status, and your mobility, what you're able to achieve. Now, general exercise, I sort of categorize into beneficial or lower risk and less beneficial, higher risk, depending on their effect on your current situation or health or your body. Now, it's going to be different for everybody, every single person. Decongestive exercises are a set of exercises devised for those who have or are at risk of developing lymphedema. And they can be very useful for controlling or preventing lymphedema, and also assisting with your preparation or warm-up or cool-down for general exercise. So they can be incorporated into a general exercise routine or be a standalone routine. We'll just talk a little bit about them in a minute, but we'll go to general exercise first. So beneficial lower risk exercises, aerobic, resistance and stretching as a group. As much as possible, the exercise should be harmonious with fluid movements, large compound movements, so multi-joint movements, low to moderate resistance or intensity, particularly initially. Varied exercises, so doing a variety of exercises, so you're doing a variety of body parts. Generally a shorter session and a regular session. So if you're going to do 5 hours of exercise a week, you try and spread that out over the week rather than doing 2 or 3 hours per day. And ideally, you want to be moving at least a couple of times a day. So beneficial or lower risk type of activities are walking, jogging, cycling, swimming and water aerobics activities, yoga, dancing, tai chi, those sort of activities. Resistance-wise, weightlifting or body weights exercises as well. So less beneficial, perhaps higher risk, sudden jerky movements, small isolation movements. So if you do have lymphedema of, say, your arm, that you're not just doing exercises of the arm. So you want to do a whole body, holistic exercise routine. Repetitive exercise, the same thing. So if you do have lymphedema in the arm, you're not just doing 50 or 60 repetitions of the same exercise. So you need to mix it up. Not performing long session or irregular session. So not just doing once every couple of weeks and going for 2 or 3 hours every couple of weeks. It needs to be a regular session once a day or more if you can. So some of the non-beneficial exercises include sort of jumping, lots of change of direction or sudden change of direction, activities or sport that may involve contact or injury, hard surfaces, so too much impact or hard impact on hard surfaces, perhaps static exercises, so where that you're holding a muscle contraction for too long in one position, can build up the pressure in one area. Long repetitive exercises, so things like marathons may be a higher risk, or training for marathons may be a higher risk for someone that's got lymphedema of the leg. Injury or compression from equipment, so things that may hit you or impact you while you're doing the sport or activity. So they've got their sailing, but also things like snow skiing, ice skiing, where there's a high compression on certain parts of the body. So you'd have your ski boots or your ice skating shoes, boots, which are high compression, so that it may be restricting fluid flow to or from that part of the body. So it would be something to consider. Now, having said all that, this will be specific to each and every person. So I would recommend that if you're looking to do exercise, you are at risk of lymphedema or have developed lymphedema, you consult with your lymphedema therapist or a personal trainer of some form, or a combination of those, to sort of tailor a session or a specific exercises for you. Some cautions to exercise. Now, some of these are general, but if you're feeling unwell, have a fever, feeling fatigued, care with any wounds or scars, particularly after surgeries, radiotherapy, taking care if you do have any devices or implants, avoid excessive or repetitive exercises, increase your intensity slowly and your frequency slowly. Always monitor for signs of lymphedema developing or progressing. And that goes for, even if you're a regular exercise, have been regularly exercising for years, you still should be monitoring at all times. As I mentioned before, work with an experienced therapist and trainer, and wherever possible, you should be wearing your compression garments. If you do have compression garments, you should always wear your compression garments, because your compression garments are designed to work better with muscle contraction. How we go for time, Deb? All right. Got a couple more.
Yeah, probably just about ready to start winding up, but that's cool. All right. I've got a couple of questions for you.
Okay, just got a couple more slides and we're done.
That's right.
Now, decongestive exercises are a specific range of exercises designed to help with your lymphatic flow. The useful addition to an exercise or activity routine, or they can be a standalone routine for someone with lymphedema or at risk of lymphedema. They're ideal for being performed prior to an exercise routine or after an exercise routine. So you're going to use them as a warm-up and a cool-down. So pre-exercise, you're warming the body up, and also sort of pre-loading the lymphatic system ready for the increased lymph flow. And post-exercise is a cool-down and helping to keep the lymphatic system functioning to help drain the excess fluid that will come to the tissues for the exercise. Now, just going to wrap up with a little bit of a plug for the lymphedema support group. We will be putting on the lymphedema support group, we're putting on a exercise or lymphatics workshop, which covers a little bit of what we've done today. And that will sort of go into a bit more detail on specific exercises for general specific exercise, and also the decongestive exercises that I've sort of been talking about. Now, that program is, we'll look at the basic anatomy of the lymphatic system in a little bit more detail. What is lymphedema and the signs and symptoms of lymphedema? Practical precautions for lymphedema, reducing the risk. Beneficial forms of exercise that we've talked a bit about today, but also how to perform those specific decongestive exercise and self-massage techniques. Now, we will be running the workshop on Saturday the 27th of June. It will be via Zoom. It'll run for approximately 2 hours face-to-face. But then for all participants, they will also get 2 sessions with me. One will be to provide the individualized self-massage sequence and the decongestive exercises for that person. And then the follow-up session will be just to answer any questions that you may have, and just to check that you're comfortable with both the self-massage and the exercises that have been provided to you. Now, the good news is that session is free. So the workshop and both the sessions with me are free. So it would just be a matter of getting in touch with Deb for that one to sort of register your interest for that. And there will be more details through the lymphedema support group as well. And that is basically it. Any questions?
Okay, so we've got a couple of things come up. One is about some spontaneous dancing as being good for some exercise. Is it worth trying to increase your heart rate, like spontaneously dancing to a tune to get the lymphatic system squeezed?
Absolutely. Absolutely. Any exercise is going to help. Yep.
And go on.
Sorry. It would just be I suppose, just taking care of how active or how vigorously your spontaneous dancing is. And ideally, if you can warm up, but then it's not spontaneous. But if you do some spontaneous dancing, just be aware that it's the best option afterward is to help, I suppose, cool down. So just take a little bit of time to cool yourself down. So maybe walk around a little bit, dance a little bit slower, do some deep breathing, that sort of elements. But absolutely, spontaneous dancing is always a good thing.
Cool. And can you just put up the second to last page? Somebody wants to see that again, if possible.
This one?
Don't know. I'm guessing they'll tell me if it's the wrong one, but we'll see. I think that's all good. The other question I've got that's specific really for you is, at what stage should someone who has had lymphedema and a DVT of the affected arm start up exercise again? And what would be classed as safe exercise?
Well, that's obviously going to depend on the specific person. Lymphedema-wise, generally I would say there's no point where you shouldn't exercise. So as soon as you feel comfortable exercising, that it's okay to go. DVT-wise, you probably need a clearance from your doctor or your GP to confirm that it's okay to exercise from there. Yep. But other than that, it would be really just a matter of when you're comfortable with it. And the forms of exercise, again, would depend on your specific situation. But you'd be still looking at a whole body routine of some form. Okay. And you may be able to do exercise if you're not able to do too much with your arm at this point, you could do some exercise that focuses on lower body perhaps. So walking, things like that.
Thank you.
So yeah, really specific on the individual.
And it was slide 29, please.
That one? So we just got some, that's just a few decongesting exercises. If we had time, we were just going to run through them quickly, but it depends on how we're going for time.
Yeah, that's okay. That's good. Well, look, and I think I'd just like to say thank you for your generosity with offering that workshop for people and for people to be able to get in touch and have one-on-one session with you via Zoom to work out something specific. I think that's the thing with the exercises, is we need to remember that really, while all movement is good, things that are specific to the individual is probably the best way to go. But all right, I think that's all for you, Richard, but thank you very much.
You're welcome. Thank you.
And